Hey y'all, I just wanted to do a quick rundown of some specialized skeletal structures that you find in the axial and appendicular skeleton. So this is just sort of a little bit more related to the physiology but also the anatomy. So this is kind of halfway in between. So remember, when we talk about the skeleton, so the axial skeleton includes the skull, the vertebral column, the ribs, and the sternum, while the appendicular skeleton, that's the limbs. So that's the shoulder girdle, which are these bones up here, and the arm bones, the pelvic girdle, which are these bones in here, and then the legs. Now, I wanted to talk to you guys about the skull, because one of the things that we won't see in the skull when we do the anatomy are these things called paranasal sinuses. So in the bones of your skull, so in the maxilla, the ethmoid, the frontal bone, you have these spaces within the bone. So you have these sinuses. They're spaces. They are open to the air. When you breathe in, air passes through these sinuses. So just like the inside of your nose, they're lined with a mucous membrane. And they do a couple different jobs. If your skull was solid bone, it would be very heavy. So the empty spaces help make the skull lighter. They also act as an air conditioner. So when you breathe in and air passes through them, it helps to warm and moisturize the air as it comes in, and then cool and dry the air out as you breathe out. So it helps you retain moisture and heat. It also acts like a voice resonance. So, when you get a cold and your voice changes, you sound very nasally. That's because the sinuses can fill with mucus and fluid. Now, normally, if you don't have an allergy or if you're not sick, those sinuses are empty. It's only when we have a problem do they become filled up, and they can cause problems like sinus infections. So those are very important structures. Now, I wanted to talk to you guys a little bit about the vertebral column. We are going to spend some time looking at the vertebrae, but I wanted to talk to you guys a little bit about the vertebral column. The vertebral column is interesting because if you look at it from an anterior-posterior view, you can see that it's very straight. There's not a lot of lateral movement, a lateral curvature to the spine. But when you look at it from the lateral view, you can see that we have these curvatures. So there's a curvature here in the cervical region. There's one in the thoracic region. There's one in the lumbar. And then this bone right here, the sacrum, and this bone in the coccyx also have a curvature. Now, it's important to remember the number of vertebrae that you have in each one of these regions. So in the cervical region, you have 7, labeled C1 to C7. In the thoracic, you have 12, starting at T1 down to T12. And then in the lumbar, you have 5, L1 to L5. Well, how do you remember that? Well, if you remember, breakfast at 7, lunch at noon, 12, dinner at 5. You remember cervical, thoracic, lumbar. Now, these curvatures are actually important. They provide flexibility to the spinal column while at the same time allowing it to be fairly strong. So you can flex your spinal column, and you can do this anterior posterior flexion pretty easily. You can do lateral flexion, but this allows you to sort of move around. Now, you can get abnormal curvatures here. So, for example, there's this one that you're probably familiar with. It's the last on this list, scoliosis. That's a lateral curvature. But you can also have these two. This first one, lordosis, that's where you get an over-curvature in the lumbar region. So down here, the lumbar curves out this way, and so that causes your hips to tilt forward. Now, you see this a lot in pregnant women, actually, because of the increased weight in the abdomen from the developing baby, from the extra amniotic fluid, that pulls the lumbar vertebrae forward, and they get lordosis. Now, the other type of curvature here is called kyphosis. And kyphosis is over-curvature in the thoracic vertebrae. So if you look back here, if you over-curvature here, what happens is the shoulders go forward, and that's sometimes known as hunchback. Those are abnormalities, and generally those happen because of changes to the musculature. Now, between the vertebrae, we have these intervertebral discs, and they're very, very important. they act as shock absorbers. So these intervertebral discs sit between the body of the vertebrae, and so when you put pressure on them, you don't have bone crushing against bone. And so these intervertebral discs are very important. Now, the way this thing is set up, they're made of fibrous connective tissue, or sorry, fibrocartilage. So they're fibrous connective tissue. They're very, very strong. And in the middle of them, we have this material called the pulposus. And the pulposus is this sort of jelly-like material. So you have this ring around the outside that's very tough, and you have this jelly stuff in the middle. And so you can squish on this and it bounces back. Now, what's interesting about this is what happens to you during the day. If you want to be taller, measure yourself first thing in the morning, because what happens is as you lay down, these discs plump up and your spinal column is actually longer when you first get up. Now, as you get up and stand around, these discs get compressed, so they push down and you actually get shorter. In fact, astronauts, when they spend any time in space, they typically come back about an inch taller than when they left because of this. Now, I know what you're thinking, go to space to be taller, but usually within 6 to 7 hours, the effects of gravity compress those vertebrae back and they're back to their normal height. Now, where this can be a problem is if these things don't work properly. So if you have damage to this fibrous ring on the outside, you can get a bulging disc. And many of us have bulging discs. It just happens. If the disc bulges towards the posterior and presses on the spinal nerve, that can cause pain. So that is actually a significant issue with this. Now, I did want to talk a little bit about some differences between the males and female skeleton. Male and female skeletons are slightly different. And I've shown you some of this in the skull. You see some differences in the mandible, in the frontal bones. So the brows are more prominent in male skulls. In male mandibles, there's extra bone here on the side. The chin is a little more squared out, it's less pointed. On the occipital bone, there's a bump called the occipital protuberance, but you can also see this in the pelvis. So if you look here, here is a female pelvis on the left, and on the right is a male pelvis. Now, the male pelvis, if you look here, this angle, so these two bones, these are the pubic bones up here, these are the ischial bones. You'll notice this angle is very pointy or acute. In a female pelvis, this angle is much more rounded. There's a really good reason for that. Childbirth. So the head of the baby, as it's born, has to pass through that pelvic opening. And so you see this difference. You also see a widening here. It's called the pelvic brim. So this part of the pelvis up here is also much wider in females than males. Now, this is a generalization. Not all female and male pelvises are built like this, but generally you see this, and these differences are driven actually by puberty. So estrogen tends to cause this sort of shape to the pelvis. Testosterone causes this shape to the pelvis. Now, the other thing about being a baby is the fetal skull. Fetal skull is really different than our skull. Fetal bones aren't fused together like in the adult skull. And this is to accommodate for two things. One, childbirth, and two, it allows the brain to grow. The brain grows very quickly, much more quickly than the skull. So you have these spaces, and so if you ever touch the top of a baby's head, they'll have this soft spot. This is called the anterior fontanelle. So there's a sheet of connective tissue, and that fontanelle allows that flexibility. You also have a fontanelle over here called the mastoid fontanelle, and that's between the parietal bones and occipital bones, right where the mastoid process would be. And again, those are accommodating for growth and birth.